nice story to the weather, but that's what's next.
Daily, we are bombarded with sound. Invisible frequencies that interact with the human body. Are these constant frequencies affecting our health? What if some of these sounds were beneficial? How do we get this information to the public as well as the medical community? Is it time for a change in our thinking about alternative methods of healthcare? Are we ready for it?
There is a change coming. As a physician who's board certified in holistic medicine, there is a growing group of concerned physicians out there that are trying to provide standard, state-of-the-art care, cutting-edge care in a responsible manner. And there are always things on the fringes, and for some people, change will never happen fast enough. We do seem to have a lot of rules and regulations that can be helpful and protect people. On the other hand, they can slow down how fast medical advances get to the public. So that can be very frustrating. Yes, there's a change coming, but not fast enough to suit a lot of people.
I think this is a technology on the very cutting edge of science. Terry has opened a door into a totally different universe that many of us were totally unaware of. And I think we're ready for it now.
In this day and age of modern science, you would not expect to see a major contribution to medicine come from any place except a prestigious medical research facility. That is obviously not the case if you consider the new and emerging field of human bioacoustics. Sherry Edwards is the pioneer who has researched this field of bioacoustics for over 30 years. In 2001, Sherry was awarded the top honor of Scientist of the Year by the International Association of New Sciences for her dedication, innovation, and leadership in the field of human bioacoustics. In 2002, she was a recipient of the O. Spurgeon English Humanitarian Award at Temple University, granted to physicians and scientists who have made major humanitarian contributions to human welfare. Her work has appeared in numerous publications, such as The Scientific Basis of Alternative Medicine, the Duke Encyclopedia of Alternative Medicine, and the Definitive Guide of Alternative Medicine. Sherry and her staff at SoundHealth Incorporated have provided the necessary techniques to develop a computerized voice assessment approach called vocal profiling, which analyzes voice patterns and produces reports which indicate which frequencies are too high, too low, or missing altogether.
We've got a huge smorgasbord of alternative things in Melbourne, in Australia. And I think it's how do you discriminate with that? And this is what I appreciate about bioacoustics, is that it is, to me, very sound in principles of physics and even in medical, biomolecular, biochemical terms. There's a very sound basis for almost explaining what's happening. So as Sherry often says, it's sort of backward. Things happen and then you try to understand what happened. And I think that's what makes it to me a very sound practice.
But as we worked here at the Research Center, we found out that the vocal cords are attached to something called the recurrent laryngeal nerve. And that nerve is in the parasympathetic nervous system of the body. So everything that happens to you that keeps you in stasis, if somebody jumps out and yells boo at you and you go, oh, and you get really rattled and your adrenaline rushes, and then your body says, she wasn't so scary. We're going to slow down here. Then your body goes back into balance. Well, your vocal cords move with every frequency set that goes from your brain to any part of your body. That's why when Ed McMahon comes to the door and says, oh, here's your $1 million check, you get really excited, and you can tell about that excitement in your voice. Or you can tell when someone is in grief and how their voice changes in expression. And you can tell who's telling you the truth because there's a lot of variance in your voice, and you can tell who's lying to you because there's only one note going on. I didn't do that very well. But you get the idea, and you can hear that in commercials when people are lying to you, that their voice is manifest of what's going on in their body. And people really know this, they just don't know how they know it, Because if you consider a young man going through puberty and all of those changes in his body in response to hormones, that's what's happening. The body's vocal indicators are changing based on the biochemistry of what's happening in the body. And it's just taken us years to break some of those codes. Now we have enough of them to know this is really going to happen, and we can control what's happening to your body. Mostly, you have a thought, it goes to your body, and you can move your finger. Now we know that we can take a frequency, hit your skin with it, have the skin absorb it, have it go into the muscle, have that signal sent back to the brain, and we can make muscles move that wouldn't move before. We can make people who couldn't use sulfur use it. I shouldn't say we can do that. The body really heals itself.
Bioacoustics literally means life sounds, and is the field of research involving the use of voice spectral analysis and low-frequency sound to help the body self-heal. It can be described as a cross between music therapy and biofeedback. Sherry has devised one of the most sophisticated mathematical systems that has provided a mathematical matrix model for the structure and function of the human body. This is not a theory. This is a viable, demonstrative living model that has helped thousands of people support their own healing potential. Human bioacoustics, however, is still a work in progress. But the use of computers has made it possible for the ideas of bioacoustics to be moved from the realm of conjecture to the domain of repeatable science and technology.
When you look at what's going on in the system, let's talk about hearing for a second. When you look at the range of frequency for hearing, which is about 14 cycles per second up to about 20,000 cycles per second, that comes into the ear mechanically takes it and changes it into electrical chemical energy, and it sends it to the brain, and the brain says, I received that in this range. I'm going to interpret that as auditory input. The same thing with smells. The nose changes it to electrical chemical energy, sends it to the brain, and goes over here, and the brain says, that's this range. That's olfactory input. And kinetic energy, anything from 3 cycles per second, which is the frequency of your heart, up to thousands of cycles per second. But the brain, that's the body speaking, but hundreds of thousands of cycles per second, even by your eyes. Electrical frequency comes into your eyes. I think it starts at about 380 trillion cycles per second. The eye changes it into electrical chemical energy, sends it to the brain, and that's how we see color. It's all based on this math pattern, this mathematical matrix of the body. And we found the codes, and it's very predictable. And we've been able to do things that even I don't believe. I watch them happen, and I can't believe it. We have a Dr. Russ Rudy, who we've been working with for a couple of years. And his story, there's this word awesome. It's just awesome because you can't believe it until you see it. He came to us on a scooter. He had multiple sclerosis. He had special hands things on his car, and he'd fold up his scooter and stick it in the back seat, and then he could drive. And when you see the films of him and how he struggles to get up the sidewalk to the office, and you look at his medical tests, and his frequencies of his nerves were dead from the waist down. Yet it took us from November of one year to May of the next year, and it regrew the nerves from his waist down. Impossible. But there it is in the lab test. So now we can believe it because it was science.
And it's reproducible. It utilizes electronic equipment and mathematics and science, and it's measurable. So it's, you can prove that it's working or that it's not working, and it's about all you can ask of any medical test.
Is that the human voice is a hologram of the human body. So according to her perception, the frequencies that are missing from your voice is what your body needs in order to reestablish the balance that a normal, healthy body should have.
I always think of that wonderful experiment of sand on a steel plate, the Kidney plates, and it's a very well-known experiment that's done in schools. And you sprinkle sand on a metal plate, a very hard metal plate, and bow the edge of that plate with a violin bow. And the sand all jumps around because the plate's vibrating, and it falls into a pattern. and you change the tension on the violin bow, which changes the note, and bow the plate again, and the sand all jumps around again and falls into a different pattern. So I see these frequencies as organising principles of matter. And it's this journey to discover exactly what is happening there and get further insights into it. That makes it, to me, a very exciting journey.
I know I took one of our physician assistants there who had a severe problem with tremor, and Sherry played a tone for him. His tremor stopped completely when the tone was being played. Very impressive. And he had been a neurologist, had full workup, had taken medicines, nothing was helping, and she finds a tone where it stops it immediately. So a lot of people, even when they see it happening, don't still want to believe it. We're just so ingrained in our mind that this shouldn't be working. The only way to make it better are traditional medical and surgical treatment. When they hear something like, I'm going to listen to you speak and I'm going to analyze it and I'm going to play tones for you and make it better, it just sounds so foreign to what we're expecting. And if people think strongly enough that it's not going to help them, I really truly believe that it probably won't. If you come in with an open mind, accepting mind, thinking that there's a good chance this is going to work, I've seen it work in so many cases, and I'm proof of it. I mean, nobody 5 or 6 years ago would expect me to be doing what I am today, me included.
The body has the ability to self-diagnose, self-prescribe, and reorganize according to its own intrinsic information. If this were not true, the body would neither repair nor regulate itself. The inherent healing of wounds and bones, recovery from disease, and the cycle of hormones, sleep, and hunger would be totally implausible. The body is capable of being self-diagnostic, but it is not so capable of self-generating the frequencies that are required for restoration. By correctly interpreting the data from the voice, specific frequency patterns can be provided that have the potential to help the body reverse its own disease. Simply put, all this is providing the frequencies that the body shows us it needs.
When you start becoming aware of your body, any part of your body, it's your body telling you where the problem is.
Late May of this year, I was involved in a pretty bad car accident. A lady forgot to stop at the stop sign, crashed into us broadside. I had broke my ankle. I had very badly bruised up my hand. There was so much swelling that I could bend my hand, my little finger about this far. This is about all I could do. And that was one of the things we looked at, and Sherry said, do you want to make that better? And I said, well, sure, why not? And so when she did the voice print, she found which muscles were in stress, played the tone to relax that muscle. And it was amazing. Within 15 seconds, I could go ahead and close my fist normally. Stop the tone, it was back where it was. It was just unbelievable to watch, and I'm trying not to be realistic about it. Is this really happening? It's just hard to believe that actually did happen, but I was there, and it was just amazing just to see it. But that's the type of things that we've seen a lot with some of the bioacoustics. So some tremendous changes there, and you still scratch your head and go, why is this working? It just boggles the mind just to see it happen.
The acceptance of new technology is usually rejected because people do not understand it. Today's medical practitioners are trained to diagnose and prescribe treatments for the symptoms of disease and other ailments, rather than exploring and treating the cause of disease and other ailments.
For us to think that doctors know everything, they don't have time to know everything. They don't have time to learn everything, and they don't have time to investigate everything. And
I'm not trying to knock down my own profession, but there is also a lot of stuff that is not, they just don't have the means of dealing with it adequately.
There are areas where things are actually almost mainstream now, and doctors don't bat an eye at it. There's still areas, such as Sherry's work, that it seems too good to be true. We still have too many people that are Newtonian in their thinking. Show me the hard evidence. whereas the newer frontiers of medicine, bioenergetics, mind-body-spirit medicine, they require more of an Einsteinian approach and more of a quantum physics approach, which is difficult because how many physicians are schooled in quantum physics? How many are going to take a remediation course just to understand what is coming out in the literature now? It's pretty much a show-me-the-facts mentality. And in all fairness, physicians in clinical practice are overwhelmed with the amount of information they have to keep up with that is already considered standard of care in their practice. And we just don't have the time to read every single thing that comes down the pike. And they tend to read mainstream medical journals, which tend to be very restrictive in the flow of alternative information.
The research that Ms. Edwards is producing has been having a positive effect on conditions such as anti-aging, pain relief, weight management, amplified immune response, and also degenerative diseases like arthritis, macular degeneration, and heart disease. The actual list is too long to include in this presentation.
Instead of being told, look, you have X number of years, prepare your affairs, or here's a bunch of things we're going to try on you, maybe you're going to get better. But then again, well, look, doesn't matter if the little hair that you have will fall off completely and your teeth will get loose, and well, that's the way medicine goes. And with her approach, there is no harm. And one of the things that you swear as a physician, the Hippocratic oath, is do no harm.
When we take an oath to do no harm, it gets harder to do that. Sticking someone with a needle to take blood sample carries more of a risk than anything that I've seen Sherry use in the last 6 years.
And one of the prime causes of harm are medications.
Most medications, doctor-prescribed medications, have you gambling with side effects. And of course they've got a use, they can have a use, but you've got to gamble there on whether you're going to react or not. And nearly every medically prescribed drug has side effects or contraindications listed. I use a lot of vitamin and mineral therapy as well. I have for many years because I did that sort of work before I met Sherry. And that's the easy way to grab a pill sometimes, but every now and then you think, yeah, but why? What is it in me that I need that again? What else am I not paying attention to in an immune process or something?
And each drug, no matter what doctor you talk to, there are no safe drugs. Each drug carries a whole gamut of side effects, and you never know what side effects you're going to get when you take the particular drug. With Sherry's approach, frequently if you uncover the frequencies that are missing and supply them to the body, it will correct them.
I have patients who've tried everything legal, done everything their doctors have asked of them, and they're still in pain. And to be able to give somebody something that is not addictive, does not cause drowsiness, is not going to get them in trouble with the law, or cause mood disorders, or problems with functioning with their family, or driving a car, or operating machinery, that can't be sold on the street or get people high. I mean, that, personally to me, is the biggest breakthrough that I've seen, and one of the biggest contributions to my practice that bioacoustic profiling provides.
I've never had any tones that have affected me negatively in any way. So I suppose there are some. I haven't experienced any of them. I imagine with almost any treatment there's got to be some downside, but I'll tell you, I think this is a pretty low-risk procedure, especially for someone who's exhausted everything else medicine has for them. It's one of these type of things, it's kind of you don't have a whole lot to lose and you have a lot to gain. So
there are a lot of medical conditions today where there is no good standard test to find out what's wrong with somebody, or there are very little testing that's possible to find out before something happens, such as an adverse side effect from medication, whether someone's going to react badly to that medicine. To find out someone's biological tendencies before there's a problem is a huge advantage. To be able to help treat people who have been through conventional medicine and their doctors have done the best they can with what's available, and these people are still not able to be helped or become fully well, it's a huge advantage. I mean, there's a lot of things that regular medicine, standard orthodox Western medicine, cannot address.
And I know my fellow colleagues listening to this, if any of them ever watch this interview, would think, well, I'm sure this is a very sophisticated placebo effect. Placebo effect, trust me, placebos, by the way, I've worked before I even went into medicine as a hypnotist, and I'm very familiar with what the human mind can do and not do, and this is not a placebo.
To have to use invasive and expensive testing that people couldn't afford or their insurances wouldn't cover, very, very frustrating. And or to not be able to get answers because of the limitations of current medical care. To be able to actually figure out what's wrong with someone and help them get well, and do it in a manner that's safe and effective is a very, very useful tool. And it'd be nice if more doctors had access to it.
The vision for the future is to allow automated online frequency templates to be used by an internet user to provide an immediate assessment report that could be used in the management of self-health. This type of pre-diagnostic tool could be used by individuals, health outlets, training institutions, wellness providers, and researchers to supplement healthcare information.
One of the phrases I came up with here anyway was download your medicine. Imagine if you can speak in a microphone, put it into your computer, and back comes a series of sounds that can help you. So, and we've talked about this. A lot of people or everywhere have the opinion that the pharmaceutical companies, once they figure out that this works, will buy it out and kill it. But I think it's the opposite. I think they're going to see the light and buy it out and sell it themselves.
It's able to be used with modern technology. You know, you take a voice print from wherever, an astronaut up in space, analyze it, find out what's wrong with them, and just like you can send a computer fix, you can send a tone, you can digitize your sound and send it to a tone box on the space station. I mean, that's phenomenal. To not have to send someone up there for a house call to the space station, which would cost a lot of money, and you'd have to have a specifically trained physician. For the government to be able to help troops in the field quickly, rapidly, be able to treat large numbers of people with pretty much zero adverse side effect. It definitely offers things that even standard medicine doesn't have right now.
We are just beginning to discover what this is and what it can really do.
Today, conventional medicine is beginning to realize the potential of sound therapy, and human bioacoustics will be leading the way. Remember, as citizens, we have the right to explore alternative methods should we choose to do so.
Patients should avail themselves of every opportunity that they have for getting well, staying well, preventing disease. Some patients are take charge of their own health. They go to the internet, they come to our offices with things they've downloaded, and they ask the doctor, what do you think of this vitamin or this therapy?
I'm speaking as a physician and a patient. I went down the medical road first. I didn't get any answers that were acceptable to me. I was placed on drugs that were very dangerous to me. I was on high-dose steroids, Valium, methotrexate. They wanted to give me chemotherapy that would have damaged my heart. In fact, I even have a neurologist threaten me, tell me, Dr. Rudy, if you don't get this chemotherapy, your spinal cord is going to be eaten away. That was the type of pressure I was put under. And fortunately, I had a medical background, and I decided that my heart was one organ I know worked pretty well, and I didn't want to damage it. And I am so glad I didn't do that. And I am upset that that was the way it was laid out for me, being a colleague talking to me that way, saying that this is, you either have this or this is what's going to happen to you. You know, that's not what happened to me. And I'm glad there are other things out there. You know, I would urge patients, you know, if you're told that you don't have much choices, and, you know, let's face it, for some of the things we have out there, we don't have very good medical treatment for. I really think we should do standard traditional medical treatment for things that are out there, where medicine helps out and does a good job. But those things that are out there that we don't have very good treatment for, you know, people that are paraplegic, quadriplegic, we don't have very good treatment for that. Why shouldn't they be allowed to try something different? People with end-stage cancers where we don't have much to offer them other than, you know, medicines to help alleviate their pain, why not try something different, especially if it seems to work so well?
I have firsthand experience that I've seen it work. I've seen it work where other things have not. I've seen it speed up healing processes, either with conventional medicine or where there is no conventional medicine even existing. It's worked. I've seen no problems with it, no adverse outcomes. It's safe, it's effective. It offers a lot of hope for particularly the disorders that are vexing modern America, chronic type diseases, diseases of aging, problems from genetics, things that are industrial disease, so to speak. You know, we can give you an antibiotic for pneumonia, but most of where the American healthcare dollar is being spent is on these chronic things, taking care of cancer patients, the side effects of cancer treatments, Alzheimer's, you know, chronic things, diabetes, heart disease. It's really taking a lot of healthcare dollars to manage those. My personal experience with musculoskeletal issues, pain is a big problem in this country. We call it the fifth vital sign. And there's been a lot locally and nationally about the problems with abuse, misuse of pain medication by patients. It's very frustrating. Pain is a really, really tough problem for these people.
Well, one of the things is to always have a good positive attitude, you know. You don't die before you die, you know. We're all going to go that way someday, but meanwhile we have to look for hope, you know. And this is one of the essential qualities that this approach has. It brings hope.
I can't think of one thing, one person on the planet that couldn't use this. But part of our trouble with it is we can't get enough people trained. We have free demo classes, we have a day class, we have computerized programs that you just punch the buttons and you don't have to do a lot. We have a week-long course that people take and learn to set up their own practice with this. We have research labs, we have internships, and for every person who comes to us that wants to learn to do this for their fellow man, we probably have 500 people who need to be seen. And appointments here are months and months out. And we are just scrambling to train as many people as we can.
You know, I'm a believer in this. I've been a patient in this. I've gotten better from this, I do believe. You know, I did everything possible to make myself better to a traditional medical way for a couple years, and I was going nowhere but just getting worse. I was taking toxic medicines. Here I'm off all medicines. I feel so much better. I've got so much strength back. I think bioacoustics is definitely something that is going to continue to grow, and we'll see more of.
Based on my personal experience, based on my position as a assistant professor, researcher, working at the local and national level in my profession, I give it 2 thumbs up.
For more information about human bioacoustics, please contact Sound Health Incorporated. The state of your health is in the sound of your voice.